Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today we are talking about heart disease prevention. It's a pretty common disease that we see here in the South, and joining us today to talk about that is Dr. John Winterton, a cardiologist with Willis Knighton Cardiology. Thanks for being here.
Thank you very much, Courtney. It's great to have the opportunity to visit and help educate a little bit and get people to realize the importance of taking care of things that can get them in trouble, not necessarily immediately, but down the road as well.
Absolutely. Okay, and so you are a cardiologist with Willis Knighton, so tell us a little bit about what you do at Willis Knighton.
So Willis Knighton has a comprehensive cardiovascular program ranging from preventive care to managing heart failure, managing heart valve disease, managing coronary artery disease, with all of the major resources available to us. And on a daily basis, we do preventive care, trying to keep people out of trouble, but we also treat heart attacks and strokes and valvular heart disease, et cetera.
Gotcha.
Fortunately, some of those things are actually preventable, so that if we're attentive to risk and lifestyle, we can make a difference.
Absolutely.
Convenient at the beginning of the year to have the opportunity to make a difference.
Yes, yeah, maybe if someone's sitting at home and they haven't made their New Year's resolutions yet, and they maybe have heart disease that runs in their family, or they already have some of those risk factors, maybe like hypertension and cholesterol that we'll talk about, this is a good time to set those New Year's resolutions.
You know, there are 6 major risk factors for cardiovascular disease, some of which are preventable and or treatable, some are not. As you alluded to, a family history is not something that you can change. And so you have to focus on the other 5. There being 6 total risk factors, but diabetes and high blood pressure, high cholesterol, lifestyle, being overweight or sedentary, and smoking. I tell patients that it's not to belabor the point, but if there were 10 risk factors, there being only 6, but if there were 10, the first 5 would be smoking. And it's a real easy target. And again, beginning of the year, a target for New Year's resolutions and something that actually has great meaning in terms of preventing events.
And when you say smoking, you're talking about the nicotine as well, right?
Yes, and that makes a valid point as well, that nicotine today is not just cigarettes, that's cigarettes and cigars, but also vaping and chewing tobacco or smokeless tobacco. All have nicotine, and all therefore have associated risk for cardiovascular disease. There's a misconception often amongst folks that vaping is not associated with cardiovascular disease, which is not true.
Yeah, right. Yeah, because it is the nicotine aspect that can be detrimental to your heart health, but then the smoking, when you're inhaling the smoke, that's not great for your lung health either, or lung cancer. Right.
Yep.
Yeah, so what, I guess, you know, since we're kind of talking about it, if someone is trying to quit smoking, sometimes they'll do the nicotine pouches or the patches. Do you feel like that's effective in getting people to stop smoking and then maybe weaning off the nicotine from there?
Smoking cessation is a really interesting topic because it's so difficult, and we deal with this on a regular basis. Often people feel like they're being persecuted when you approach it with them, but the honest truth is that this has been looked at extensively over the last 30 or 40 years, and you have to make your mind up, wrap your mind around the idea that you're going to not smoke. And then the other assets that we have to use become in play, be it chewing gum or patches or several other drugs that are associated with enhancement of success with smoking cessation. Unfortunately, none of them work if you're not committed to the idea psychologically.
Right.
And so I encourage people to pay careful attention to what they want to do as far as smoking cessation is concerned. Think it through, pick a time when it's reasonable to think that you would be successful, and at that point approach it. And always the best choice is to discuss it with your primary care provider, as well as your cardiologist if need be, to gain some access to other interventions that might be useful.
Right, yeah, having a support system is always important too when you're starting something
Correct.
that might be a little difficult. So,
Very.
yeah, yeah.
And then the other five risk factors, of course, family history we can't change, but attentiveness to the what we call comorbid conditions or diseases that exist at the same time as others, specifically diabetes, high blood pressure, and high cholesterol. And all of these, unfortunately, are pervasive in our community, particularly in the South, where food is a priority in our lives. And it's not that it shouldn't necessarily be, but we have to be careful that we're paying attention to moderate and then alter diet when it's necessary to avoid things like diabetes.
Right.
Diabetes is a very common problem. It has multiple manifestations in terms of complications, heart disease, heart attacks, strokes, etc., being one, but it certainly affects the eyes and the kidneys. And so a comprehensive approach to that is critical. Again, talking to your primary care doctor and developing a plan to contend with the associated features of diabetes.
Right.
High blood pressure affects about 50 to 75 million Americans in this country, obviously many more worldwide. On an almost daily basis, the goals for blood pressure management are adjusted to accommodate what we learn about high blood pressure and its effects on cardiovascular disease specifically. Today, the goal of blood pressure management is to keep blood pressure less than 130/80. A lot of people say, well, my blood pressure is 135/85. Well, that's not bad. It certainly doesn't sound as bad as 160/80. Unfortunately, the statistics bear out a double of the risk of cardiovascular events and death with blood pressures over 140/90.
Wow.
So critical to pay attention to this. Again, a comprehensive effort between primary care doctors and cardiovascular physicians.
Absolutely.
And then lastly, high cholesterol. And again, high cholesterol is a genetic issue by and large, although we often compound that problem with our diet. And fortunately today, with 4 or 5 different classes of medications, we can make a big difference in the management of high cholesterol, and therefore reduction in event rates for heart attack and stroke, and improvement in survival. Up to 50% improvement in survival with management of high cholesterol.
That's awesome.
And if you put all that together in one big package, you can make a substantial difference.
Yeah, and that's the big topic that we're talking about is preventing heart disease and your risk for that. But right now we do have our first caller of the day. Renee, thanks for joining us. And what is your question for Dr. Winterton?
I wanted to ask him if your mother has had open heart surgery and you have high cholesterol and stuff, could we see him for a testing, or do we have to go somewhere else to check on things?
As cardiologists, we do a lot of preventive care, and certainly we would be happy to see you and work in conjunction with your primary care doctor to alter your risk and hopefully keep you from having to need bypass surgery. That's the goal, and keep you around to help be with your family.
Yeah.
Okay. All right then. Well, thank you so much.
Yes, ma'am.
Yeah, thanks, Renee. And if you're just joining us, we do have those phone lines open right now. The number is right there on your screen, 318-219-4569. Again, we're talking with Dr. John Winterton, a cardiologist in the area with Willis Knighton Cardiology, and we're talking about preventing our risk for cardiovascular disease, which is pretty common here in the South. If you have a question for him, just give us a call. Yeah, and so it is one of those common diseases that is, rampant across the U.S. and also in the South. And we do have a question, so we'll put a pin in that and come back to it. But Laura, thanks for joining us. And what's your question?
Hi, I have a question. With medical marijuana being so prevalent now and being prescribed, how does that affect your heart? Smoking, I mean, not the gummies.
Well, the effects on cardiovascular disease are somewhat unclear relative to cannabis consumption. There's a lot of concern about what that does to overall brain function long term. But as far as the heart's concerned, it's not clear the actual effects of cannabis by itself. Now, smoking itself bears some risk relative to cancer risk and obstructive pulmonary disease, et cetera. I think it's important to maintain very careful distance from things that we don't clearly understand. We're very careful to not prescribe medications when they're not appropriate or where there's not a clear indication, because they too can have associated problems. To do that, to consume products that have no clear, we have no clear understanding of their effect on health is, I think, very dangerous.
Would that be similar to like burning fire, smoke? I mean, is it just the smoke, or was it the nicotine, or what is it that's causing the heart disease?
Right. Well, relative to smoking, it's the consumption of nicotine, which is related to cardiovascular disease, and that nicotine can be absorbed through smoke in the lungs, but also through the mucous membranes in the mouth, so absorbed easily. Now, the smoke itself, as you alluded to, is more of an issue relative to damage to the lungs. And so smoking cigarettes poses a double risk.
All right. Thank you.
Yeah, thanks, Laura, for joining us. And if you had a question, give us a call, 318-219-4569. Again, our topic is preventing heart disease. And so we're talking with Dr. John Winterton, cardiologist, about that. So give us a call. So we were talking about those big lifestyle or big risk factors, the 6 big ones. And we mentioned diabetes as being one of those, or type 2 diabetes, or both type 2 and type 1?
Both are important. Unfortunately, type 1 diabetes typically occurs in younger age, and so patients are forced to deal with the effects of diabetes for a longer period of time. They are somewhat different diseases. Type 1 diabetes is associated with lack of insulin production, whereas type 2 diabetes is, as far as cardiovascular disease, is a little bit bigger issue, because it actually is a disease of excess insulin. Insulin is a wonderful thing. It helps get sugar that you consume and gets into your bloodstream into the cells that your body, and help your body use the sugar that's available for energy. Unfortunately, excess insulin is associated with lots of problems, including the growth of smooth muscle cells and scar tissue in arteries, and the deposition of cholesterol. It's associated with thickening of the blood, so to speak, as well as blood clotting. And so, and that is the milieu that is associated with cardiovascular events, heart attacks and strokes.
Okay. Yeah. We have another question. Jim is on the line. Thanks for joining us. And what is your question?
Hi, doctor. I just have a question. I'm 69 years old. My body mass index is around 22. My bad cholesterol is below 100. My good cholesterol is over 60. And my triglycerides are over 100. So that being said, I had a cardiac calcium screening about a year ago, and 2 of the results were 0. 1 was 3, but one of the arteries showed a 32 as a score, and it was the LDA. I believe it's the left descending artery, I believe is what it's called. So my family doctor doesn't think that's going to be a problem, but is that something that you think I should be concerned about, or am I okay?
So that highlights a really interesting issue. People in our country have a wide prevalence of cholesterol plaque in arteries, and that process begins, we think, as early as potentially age 18 months. It's detectable by microscope at that point in time, and that process continues as you get older. It can be seen with the naked eye if you're looking at pathology specimens at age 32. In large arteries like the aorta. Unfortunately, you can't be running tests on people that require radiation or open surgical procedures just to look at arteries. And so we're left with identifying folks who are at risk. The calcium score CAT scan is a really good tool to enable us to see whether there is calcified cholesterol plaque in arteries supply in the heart. Calcification in the arteries is the end product of cholesterol buildup and inflammation. You can kind of equate that to looking at your knee. If your knee gets injured and you develop calcium and all the things that go with that. So if you have calcium in the arteries, it means that you have some cholesterol plaque. There is a scoring system, which is what you alluded to with the number 32 in the left anterior descending artery, which is the artery on the front side of the heart. We know that if the calcium score exceeds 300 total, the risk of cardiovascular events, of heart attacks and so forth is higher. And in that instance, calcium score greater than 300, we typically want to look a little further. But it's yet inescapable the fact that there's cholesterol plaque there. And unfortunately, any amount of cholesterol plaque is associated with accelerated risk. And so typically what we would do in this situation is focus on keeping what's there stable and preventing it from worsening. And that actually is a fairly simple project if you look at the 6 major risk factors. Can't change the genetics, but you can certainly not smoke, pay attention to your cholesterol. You alluded to your LDL cholesterol, the bad cholesterol. If you have cholesterol plaque, that should be kept below 90. If you've had an event, you've had to have bypass surgery or stents, or have had a heart attack, that number should be kept less than 55. And just as blood pressure goals decrease almost on a daily basis, our lipid goals decrease as well. So you have to be very attentive to those things because, again, the object is to prevent that cholesterol plaque that exists from worsening, and you certainly don't want more. Good news, all of that's achievable if you pay attention to those issues.
Okay. So if it's at 32 compared to a score that's alarming at 300, I'm aerobically active, I'm not diabetic, so I don't have any reason to be losing any sleep over this is what my take is at. Is that correct?
I wouldn't lose sleep, but I would also not lose diligence. That's stuff that needs to be followed, and you need to see your primary care doctor and pay attention to your cholesterol, make sure, because that can change, as can your blood pressure. Unfortunately, blood pressure is referred to as a silent killer. And the reason it's silent is because many people don't have awareness that their blood pressure is elevated. And while your blood pressure might be normal today, might not be even under different circumstances tomorrow. So attentiveness to those risk factors is critical.
Okay, well, thank you so much. I appreciate the information. I really do.
You have a good day.
Yeah, great stuff. And we can talk a little bit about the blood pressure since we just finished with that. You know, it's the silent killer. And I feel like a lot of people, you mentioned a number of how many people have high blood pressure in the United States. I can't remember. It was a lot of people.
50 to 75 million.
Wow. Yeah.
It's very impressive. And there may be more, it actually may be worse than that because we don't pay attention to blood pressure carefully, typically until people get a little older.
And we also have another caller. Thanks for joining us. And what is your question? Thanks for joining us, Les. And what is your question?
Yes. I have high blood pressure. Recently, my heart hurts. It'll hurt for a few minutes and stop it off and on. Is this a serious problem?
That could be a serious problem, and that's something you need to see your doctor immediately about, or certainly if it is an ongoing issue, you go to the emergency room. It's not appropriate to sit home having chest discomfort. Always, if you're having chest discomfort of any kind, that needs to be addressed with a doctor immediately.
Can I call a doctor's department up to Willis Knighton and get an appointment?
Absolutely. We'd be more than happy to help you and have all the resources available at Willis Knighton to take care of that kind of a concern.
Just dial the main number?
Yes. 318-212-3959.
395. Thank you very much.
You're welcome.
Thanks, Les. And he brings up a good point. So, having a heart attack or stroke or anything, that can be really serious, and that's something that you'd want to get checked out, maybe go to the emergency room. What are those symptoms and signs?
People often think that heart attacks are chest pain in the center of their chest and goes to their left arm. That's only those what we call typical symptoms occur only in about a third of patients. Unfortunately, it can be pain, pressure, tightness in the chest, the arms, the neck, the jaws, shortness of breath, not able to perform activities as you would expect, but always in the situation where a person has chest discomfort that's not going away immediately, getting immediate attention is critical. There's a window of opportunity about 90 minutes long from the onset of a heart attack until we can get an artery open in the cardiac catheterization lab and put in stents. If you exceed that 90-minute period of time, then the chance of significant heart muscle loss and therefore increased risk for poor outcomes goes way up.
Wow, yeah, so definitely want to act fast for sure.
Absolutely.
Well, we have Verna on the line. Thanks for joining us, Verna. And what is your question?
My question is, this last time, which was the 22nd of last month, I had the first time ever, all my blood levels and everything have always been very good, but my cholesterol was extremely high, higher than last year. And I was just trying to find out, what are some foods, I know I should stay away from fried foods, but what are some foods that I could use, or how could I change my diet?
So fats, specifically cholesterol, are found typically in animal products. And so unquestionably the target for diet adjustment is to get as much in the way of fruits and vegetables as you can possibly achieve. Now, there are not many people who are capable of exercising the discipline of being vegetarian. And in fact, there are elements of fats and carbohydrates that are important in your diet. The general rule is you should have about a third fat, a third carbohydrates, and a third protein in your diet on a daily basis. And we want to avoid saturated fats. Saturated fats are going to be found primarily in animal products, so that's going to be meats and cheese and dairy products and such.
I was also going to say I have a segment with KTBS Courtney's Kitchen, and today we did something on anti-inflammatory diet, like the Mediterranean diet, where it's you have fats in your diet, but it's unsaturated fats, the anti-inflammatory nuts, seeds, fruits, and vegetables. And so I'll have that on our website as well if you wanted to check that out. That would be helpful.
There's recent data published in the last week or so that suggests that people pay careful attention to the two diets, one being Mediterranean diet, but also the DASH diet. Both are very, very oriented around low sodium and low saturated fat and appropriate calorie consumption.
Yeah, dietary approaches to stop hypertension, right?
Correct.
Yep. Pretty cool. Yeah, thanks, Verna, for your question and for joining us. And if you have a question for Dr. John Winterton, we're talking about preventing heart disease and just lifestyle factors to change and what to do if you are diagnosed with cardiovascular disease. Give us a call at 318-219-4569. We'd love to hear from you. And in that same note, let's say you were diagnosed with heart disease, or you have hypertension, or you have high cholesterol. You were mentioning some of those medications that, let's say someone has maybe implemented lifestyle changes, but they still have high cholesterol, maybe due to genetics or hypertension. What would you recommend for them?
So if you go back to the mid-1980s, the advent of actual drug therapy for high cholesterol was with a drug called pravastatin, which was the first of the major statin drugs. There was actually one prior to that called Mevacor or lovastatin. But pravastatin was the first of those drugs that was studied heavily at preventing heart disease and showed substantial improvement in survival and reduction in events. After that, over the course of the late 80s and the 90s, other statin medications came out. What we refer to now are high-intensity statin medications that are very effective at lowering LDL bad cholesterol to the goal levels that we have today. Some people struggle with tolerance to those medications, and some people actually have cholesterol that's not responsive enough to achieve goal with cardiovascular disease. So over the last 20 years, there have been a lot of work done to find medications that were more effective and got around some of the side effects. And fortunately, we have some of those, three of which are injectables and can be administered in less frequent intervals, one of which is every 6 months. And they're very effective. Those drugs typically today are being used in patients who have existing cardiovascular disease. The goal of treatment for that group of patients, people who have had a heart attack, who've had a stroke, or have had stents or bypass surgery, are more stringent. We look to try to achieve LDL cholesterol typically below 55. And that's not really achievable in most people without medical intervention, without pharmacologic agents. And we have those today that can achieve that. And fortunately, upwards of 50% reduction in heart attack and stroke, as well as mortality.
Yeah, okay, good to know. And that's something that they could talk about with their primary care or cardiologist if they were interested in getting on that. Okay.
Yeah. A lot of options.
Good deal. Yeah, so we were talking, about an anti-inflammatory diet, and fish is typically one of those foods that is really good for your heart with the omega-3s. But for someone that maybe doesn't like fish, or maybe they don't get enough of that in their diet or omega-3s, would you recommend a fish oil supplement?
Fish oil supplements are useful up to a point. Excess consumption of fish oils is associated with some bleeding risk because the fatty acids that are in fish oils are in some ways related to the fatty acids that are involved in the coagulation system. So we don't want to advocate for excess consumption of fish oils, but fish oils are useful, and the consumption of typically cold water fish, salmon, haddock, hake, cod, those fish are all loaded with appropriate amounts of unsaturated fats that are helpful.
Okay, good to know. Yeah. So we talked a lot about, we haven't really talked about exercise. We've talked about lifestyle factors, diet, and preventing hypertension, cholesterol, and diabetes, but exercise is really important for your heart too. So what would you suggest for someone?
Exercise is a major issue, and it's really interesting that and I like to reference two rather old studies at this point that were performed in women about 25 years ago. They were both studies commissioned by the World Health Organization. Both had large numbers of patients involved, around 100,000 each, HERS and HERS-2 studies. And those studies were initially designed to look at hormone replacement therapy in women, but they carefully looked at other portions of those patients and learned that in looking at roughly 11 or 12,000 patients in each of those studies, that walking 30 to 45 minutes a day, 5 days a week, is associated with a 47% reduction in mortality.
Wow. That's awesome.
It's incredibly simple. That requires nothing more than a pair of shoes and getting up to get moving.
Right.
Now, unfortunately, that does not include your daily activity walking, and so one has to be careful that you look at this appropriately and add the walking, and that should be done after an evaluation by your physician to make sure that you're safe.
Good deal. That's very compelling evidence too. Just get some.
One of the most
in,
powerful pieces of information that we have that gets poorly visited, but it doesn't have to be complicated.
Right, and that's the best piece of advice. Don't just keep it simple. So, well, thanks, Dr. Winterton, for joining us. This will be posted on our website at ktbs.com/healthline3 or /podcast. And thanks for coming in. It was great information.
Thank you very much.